All right, my name's Polly Armour. Some of you know me from previous conferences. Others know me from the research room in the back. I went to Germany 3 years ago and had surgery with Dr. Stutz. I was one of his first American patients and one of the first Americans in this sort of circle of people to go over to Germany or anywhere and have liposuction for lipedema. Since then, I've started working with him. I'm going to disclose that I actually work for him as a sort of sub-consultant doing patient preparation. I help organize his trips to this continent and so forth. And I'm also a volunteer with the TREAT program. So I'm going to talk a little bit very quickly. I'm going to talk really quickly because most of these slides, all of my slides and many of the slides from the other presenters will be available after the conference on FDRS's website. So you don't need to scribble notes too much, but they will be there. His liposuction was first done in France in the 20s. Unfortunately, somebody got gangrene and lost their leg, so it fell out of favor. Then in the 70s, some Europeans developed the wet technique, blunt tip cannulas and that sort of thing. Post-surgical compression, that improved the outcomes quite a bit. And then the father of tumescent liposuction, Jeffrey Klein in California, developed the tumescent technique. His textbook is available online. You can download it and read it if you want to know more than you could ever need about liposuction. But it's one of the most popular cosmetic procedures in the world. 1 million people plus go through it every year. And there's all kinds of different versions of them. If you are paying attention on Facebook or any of those things, you hear about Wall and Tall and Smart Lipo and all of those. So I'm going to try and very briefly explain the difference of those. We hear about tumescent. All of tumescent liposuction uses tumescence. Tumescence just means to swell. So a fluid that's based, it's a normal saline fluid, almost like contact lens solution. It's introduced into the subcutaneous space under the skin. It's got an anesthetic. Usually in the US it's lidocaine. It's got epinephrine, which constricts the blood vessels so you don't bleed as much. This is used in all kinds of the wet lipo, whether it's water assisted or it's straight tumescent, all of those. Okay, that's different. The tumescent fluid is used in all those procedures. Tumescent technique is when a large volume of that solution is introduced until the skin is very firm, like a watermelon. Spend about 20 minutes waiting. That fluid enters the fat cells and causes them to swell, and then a cannula is used to aspirate them out. That swelling process makes them easier to remove. And so this is a picture of Dr. Raprick. He's introducing the tumescent fluid to swell this patient's limbs. You can see the right leg there has already had it done. You see how much more swollen it is than the rear, than the one in the back of the frame, the left one. Okay, water jet is the one that was developed by Dr. Stutz. A number of US surgeons have learned it from him. A small amount of the Klein solution is introduced just to numb the area and constrict the blood vessels. And then a fan-shaped water jet is used to dislodge the fat cells, and then they're suctioned off. Okay, so Vaser, it's sort of the up-and-coming technique. I don't know much about it. It doesn't have a lot of it hasn't been used long to treat lipedema. Some people say that it's really good for the fibrotic areas. A probe is inserted. So the patient is tumesced, similar to a tumescent technique. A probe is inserted that transmits some ultrasonic vibration that ruptures the fat cells, and then the resulting mix is suctioned off. Okay. Tumescent and Wall are, in the end, the result is the same. There's a couple of differences. Tumescent uses a lot more fluid because you're swollen up like that watermelon. Wall can require fewer procedures than tumescent because you're not being swollen, so it doesn't overload the body with fluid. In the United States and even in Germany, where liposuction has been performed for lipedema for a long time, more surgeons are familiar with tumescent. It's just more commonly used, but in the end, they have similar results. Okay, it is not the brand name of the gizmo that matters. It is the hand that holds it. And how many people here have already undergone liposuction? Okay, a fair number, looks like about a dozen. The most important thing is your level of comfort with the surgeon you choose, okay? Because it is not at all a drive-through procedure. It is not an in and out. It is a many-month process, will require an incredible amount of intimacy with your surgeon. I had no idea, and I don't just mean physical intimacy. You have to really know what's going on with them. They need to know what's going on with you. And it's really important that you have someone that you can work with. Okay, so like this is a great conference because there's so many surgeons here, you can meet them and kind of feel them out. You'll know when you talk to the right guy, you'll get the right vibe from him. So cosmetic liposuction, it's all over, you know, every bus station, and Women's Magazine has it. Fournier, who was one of the pioneers in liposuction, said that cosmetic liposuction, a good outcome is determined not by the fat that is removed, but the fat that is left behind. That determines success because then the patient has smooth skin, they have an evenly contoured body, and they look good, no dimples or divots or craters in their skin. Liposuction for lipedema, on the other hand, is different in that it really shouldn't leave behind any fat tissue, or at least not very much, even when it is at a cosmetic disadvantage for the patient to do that, because the primary goal is to get the diseased tissue out. So if you're going to prepare for it, the first thing to remember is what liposuction can do for lipedema. It can remove pain, it can improve mobility, and it can prevent progression to the latter stages, okay? It is, okay, so this is from Dr. Raprick. He did some postoperative follow-up with his patients after 6 months. I think this is where things get lost in translation between German and English. It's the decrease in impairment of quality of life, which really means that their quality of life is getting better after the surgery. So it's the decrease in impairment. So you see that after 6 months, they have the majority of patients have a less impaired quality of life. But however, you might notice that thing up there, that mark up there, that's a patient who didn't improve at all, okay? So it doesn't work for everyone. This is from Dr. Schmeller's group. This is a follow-up that was done for 8 years. Pre-liposuction, you can see where people were on the left there. 4 years later, pretty much everybody had a significant improvement. And then 4 years after that, you can see that they weren't as improved. They'd gotten a little worse. But what happens after 8 years? Everybody's 8 years older. So how much of the symptoms are due to just being 8 years older? I know I hurt more than I did 8 years ago because I'm 8 years older. So that's one thing to understand. If you've been to an FERF conference in the last few years, you've seen Dr. Stutz's presentation about how the gait improves. And that's one of the things that we're looking at in the back room. Trying to put some more numbers behind that sort of thing. So how to prepare? Remember what it cannot do. Liposuction is not, no matter what anyone tells you, it is not a method for weight loss. And liposuction for lipedema is not primarily a cosmetic procedure, okay? My dad had skin cancer on the end of his nose. He had it removed, okay? When it was done, he looked better, because he didn't have this black spot on his nose. But that was not the reason that he had the spot removed. Okay, so look at it that way, all right? It's also not a time machine. You may feel younger, but you won't really be younger. You're still gonna be whatever your age, okay? And it will not cure other problems. If you have, you know, particularly things like rheumatoid arthritis or multiple sclerosis, that sort of group of kind of things that wax and wane. If they may make them easier to deal with, but they won't go away. The surgery itself can be a little traumatic. It may stimulate a flare. I don't know, you don't know, who knows, okay? And the last thing is it doesn't change other people. As my mom would say, no matter where you go, there you are. Okay, so your boss is still gonna be a jerk. I still had 2 teenage children. You know, that did not change, although they're not teenage anymore. Okay, the most important thing besides choosing a surgeon is making sure that you have reasonable expectations, and don't expect your doctor to give you predictions. okay? I'm going to make you look like Marilyn Monroe. If they tell you that, unless you look like Marilyn Monroe when you walk in there, they're not giving you the full story, okay? Work with them instead to set goals, okay? What symptoms bother you the most? Where would you like to see improvement? And here, would you be satisfied with a 50% improvement? Would you be able to walk, 10 times more than you are now? Well, would you be happy if you could walk 5 times as much as you walk now? Okay, the average patient gets significant improvement, but each of us, the thing to remember, each of us is an individual, not an average. You saw that graph we had before where there was one person who had no improvement, okay? It is possible. So these goals are not guarantees, they're goals. Okay, so here is again one of Dr. Raprick's graphs. These are the average results after 6 months. Okay, and if you look and you compare, I don't know if you can see those numbers that well, but the one that has the lowest or had the least amount of improvements was, are you satisfied with the appearance of your legs? Okay, that's because this is not a cosmetic procedure, remember? Okay, and a very large person is not going to get magically very small. Also, it didn't really make, all of these changes are significant, but if you look at do you bruise easily, people still bruise a bit afterwards. It doesn't completely fix that because it doesn't change whatever the underlying vascular problem is. Okay, what determines a cosmetic outcome, which you can define as reduction in size, your skin retraction, improved body proportions, all kinds of things. Age, stage, genetics. That's the wild card. That's the one you can't look at somebody and say, oh, you're going to be better, because we don't know, okay? You can't predict it. Which of these patients, these are a couple of Dr. Stutz's patients, which of these patients is going to have a better cosmetic outcome? What do you think? The stage 1 or the stage 3? Who thinks of stage 1? Raise your hand. Okay, who thinks the 3? Ha. Look at that. The cosmetic difference just from looks, from optics, as they say in Germany, the stage 1 person looks better, but it's not a huge change. But look at the change that the stage 3 person had. That's amazing to me. Now, does it mean that every stage 3 will get that? No. This person happened to be very young, and she must have had good genetics that gave her good skin retraction. Okay, so that's the thing here. Here's another woman. This is another stage 3 lady. Okay, you can see she's better, but she's not Marilyn Monroe. Okay, and her mobility is much better. All that sort of thing happened, but she still has some lobules and some large, heavy legs. So we talk a lot about fibrosis, and you may hear it. People say, oh, I had a lot of fibrosis. If you were evaluated by Dr. Herbst, it's one of the things she looked at. That's just extra connective tissue inside the fat, okay, in our lipedema fat. And that's one thing that we lippy ladies seem to do. We develop a lot of fibrosis in there. And it makes the fat that's in there hard to remove, okay? We are not cream puffs. It's not like sucking the filling out of a jelly donut. We're not snowflakes for sure, but we're not cream puffs. We're more like bunches of grapes, if I'm going to stick with the culinary analogies here. The grapes are the fat cells, but the fibrosis is the stems, okay? And so the liposuction can remove the grapes, but it leaves behind the stems. And the mechanical action of the cannula can break it up a bit, and the compression will squash it smaller, but it's not removed by liposuction. So the more fibrosis you have, generally the less shrinkage you're going to have. Okay, 3 ways to prepare. Physical preparation, get in the habit of walking as much as you can before surgery. Frequency is more important than duration. Don't worry if you can't walk a mile. If you say, oh, I can only walk 50 feet, then walk 49. Do what you can. Okay, frequency is much more important. It will help you take advantage of the improved mobility that you'll have after the surgery. Also, don't try and lose a lot of weight beforehand, because that will make you have more excess skin that needs to retract. Deal with the liposuction, get your skin as retracted that way as you can, and then go from there. And of course, eat healthy, don't smoke, yada, yada, that stuff. Mental preparation is a bit of a challenge. Know that you will face them. Promise to be gentle on yourself. Remember your goals that you set. Keep a log. okay? So you know that, hey, wow, I couldn't walk 50 feet. Now I just walked a quarter mile. That's significant. I'm amazed. Remember those things. And absolutely, above everything else, prepare to have patience, because although your pain very often goes away right away, the cosmetic change, whatever it's going to be, the shrinkage and improvement that you're going to have is going to take at least 6 months. And some people are still improving 18 months later. So keep in mind, this is just an endocrine order, and when you mix it up with liposuction and you knock a lot of hormones loose, and you're resulting, this hormonal surge can make your next period a lot more intense. This will pass. 6 months after surgery, I've noticed a lot of women go through a kind of emotional crisis. The pain that they had from the lipedema is long gone, but they look in the mirror and they say, is this all I'm going to get? Okay. The thing to remember is that you have to kind of go through a little bit of a grieving process, and that's normal. Okay. Know that it's coming, and just know that it too will pass. Okay. It takes time. Okay, you kind of have to go through a grieving process. This is something Dr. Rappert said at last year's conference. I thought it was profound. Lipedema patient's body undergoes a very dramatic physical change in a very short period. It's positive, but it can happen faster than their brain can process it, so be aware of this and don't underestimate it. We're going to avoid the emotional pitfalls, so don't compare yourselves to others. It is not a competition, and we see on Facebook that, you know, oh, I went to Dr. such and such and he took 5 liters out of, you know, so-and-so's lower legs only. Isn't that amazing? But my doctor only took, and I'm going to tell you, my doctor only took a liter, less than 2 liters out of my legs total, and I just want to show you here what this means. That's a liter. This is another liter. How could anybody take 4 liters out of my lower legs without amputating them at the knees? Okay? It is not a contest, and it is not a competition. Our bodies are obviously different. Okay? Other people's pictures do not tell your story. We see all these before and afters on the Facebook groups and in other places, and they worry us. You know, here's a photo I took on the New York City subway. These 2 beautiful before and afters. Can anybody read that small print right there? It says, model used for illustrative purposes only. Results may vary. Okay? Now, here's another thing. I found this on Vaser's website. This is a screenshot. Can you read what's down in that little purple thing there? You can't read that? Not an actual patient. Okay, if it's not a patient, what is it? This is a model. She's paid a lot of money to pounce around in her underwear and make us feel inadequate. That's her job. Okay? So what's the alternative? Remember your goals and focus on the NMVs. They talk in the keto groups about NSVs, non-scale victories. NMVs are non-mirror victories, okay? I thought I was going to give all this stuff up. Time's up, okay, I'm rushing. And it found out that, hey, guess what? I didn't have to, so some last words. Be gentle on yourself. Remember how far you come. Check in with your friends and family. They'll help keep you honest. And pay it forward. One of the most worthwhile things I've done for my own recovery and accommodation to this is to help other people in the same journey. And I got to tell you what a huge privilege it is not only to work with Dr. Stutz and Dr. Herbst in some of the things we've been doing, but to work with all of you and be here in front of you. And thank you all so much for those that have participated in the Gait study. Yay!